Hello, my name is Dara Casey, and last year I published this book, Cycling for Health: Why Investment in Cycling is Needed. It's a short introduction into the health benefits of cycling upon individuals and society. And to mark 1 year since publication, I've put together this presentation to run through the contents of the book. This is the structure for what I'll talk through, from some of the background as to why I wrote it, to what I think are the key takeaways from the messaging in the book, to a snapshot of each chapter, and in the end I'll share my details if anybody wants to get in touch. Why I wrote it? I wrote it because, one, I have a very positive personal relationship with cycling. I've been cycling for as long as I can remember, to get from A to B, to get to school, to work, for adventure. Cycling is a very joyful experience for me, and over time I've experienced the physical health benefits. More immediately, I've experienced the mental health benefits, from reducing any stress, increasing clarity of mind, just making myself feel that little bit better. In addition to that, I work as a nurse, and since embarking on my nursing from doing my degree through to now, public health, prevention, physical activity, these are my areas of interest. And I wanted to echo the calls that are already out there in the need to increase investment in cycling. I think it's good to echo and share and amplify this message from lots of different places, and I wrote this when I was working as a community nurse within the NHS, within the system of the NHS, and I think it was good to share the transformative potential of creating a cycle-friendly society. And I'm now going to talk through what I think are the key takeaways from the book. What's fundamental is that our shared physical and social environments shape our health. Our immediate surroundings are so influential to our health and quality of life. And although this quote isn't included in the book, I came across it again recently. I really like it, and it captures what I sought to express in the book, which is the need to focus on the real drivers of our physical activity levels and our collective health. It's from the 2020 Marmot Review on the need to focus on the structural drivers of health inequalities. Avoid talking about choices, lifestyles, physical activity. Instead, talk about options, opportunities, and places. In the end, I sum up my argument and state that we must increase investment in cycling. Prior to 2020, in recent years, the public expense on cycling and walking and active travel as a percentage of the total expense in transport was just around 1.5% in England, and that's far too little. In the last year and a half, within the devastation of the coronavirus pandemic, there have been positive changes nationally and locally in terms of enabling cycling and the rhetoric, but Amsterdam and Copenhagen, these places weren't built in a day, and their cycling infrastructure and the popularity of cycling as a mode of transport wasn't an overnight thing, and so years and decades of long-term sustained investment is needed to tap into the potential of cycling in the UK. And when I talk about investment, this image largely captures what I'm talking about. I'm talking about physical infrastructure, protected cycleways, which enable people to get outside and safely cycle. And I really like this image. It's from London, from Cycleway 3. It shows that the cyclist is prioritised over the motorist. The first chapter is entitled Our Health in 2020, and I start by pointing out that systematic and preventable health inequalities are continuing. In the graph here, I illustrate female life expectancy and healthy life expectancy, and you can see from the most to the least areas of deprivation. For example, in decile 1, women are living with 18 fewer years of healthy life expectancy compared to decile 10, and you can also see in decile 10 that people are living a far smaller proportion of their life in poor health. And it's worth noting that physical activity levels also follow a social gradient, and those who are more advantaged are more likely to move more. And I go on to highlight the burden of disease from non-communicable diseases, that people are living with and dying from these conditions, and link that to cycling, as cycling and provisioning for safer cycling can help reduce the leading cause of death across age groups in the UK. In the image here, I've highlighted those leading causes of death which could be prevented, reduced from provisioning and investing in cycling. Transport has got to do with the improvements in road safety. All of the others are linked to the health benefits from physical activity, as increased volumes of physical activity reduces your risk of heart disease, dementia, lung cancer, breast cancer, colorectal cancer, stroke. And that's taken from the US 2018 scientific report for their physical activity guidelines. So the public health case is a compelling one, as investing in cycling can support people throughout society and reduce leading causes of death. I then go on to talk through determinants of health, and the first one is education. Improving educational outcomes. Higher levels of educational attainment are linked to better levels of self-reported health and higher levels of healthy life expectancy. We know anecdotally that physical activity is so good for us, important, and there's also the literature and research to back that up, and showing the benefits for school children. There is an association between PA, physical activity, and cognitive flexibility and academic performance. It has been shown, for example, in the UK that higher levels of moderate to vigorous physical activity undertaken at 11 years of age was associated with higher English, maths, and science at 11, 13, and 16 years of age, which is incredible. And in Denmark, they looked at over 20,000 school children, and they found that those who cycled to school had improved concentration levels, lasting up to 4 hours after cycling. And the image there is of a cycle bus near Coventry. Cycle buses are initiatives which have popped up and grown in popularity around the UK and Ireland, as volunteers, adults, cycle alongside groups of children to enable them to cycle safely to school. And this is a reflection of the recognition of the health benefits of cycling to school. It also probably reflects the lack of safe cycling infrastructure that there should be, which would enable children to cycle to school independently. And in the next chapter, I talk through why infrastructure is just so important. Access to green space is linked to better health outcomes, improvements in mental health, self-reported health, and reductions in all-cause mortality. I then go on to link this investment in green spaces, be it parks, play areas, allotments, cycleways, greenways, to, well, it means designing for livability, where people dwell, where people can linger and spend more time outside. And cycling and the infrastructure to enable people to be outside and access green space is so important. Creating a safe environment, which is what you can do with protected cycleways and prioritizing cyclists and pedestrians over motorists, enables people to get outside and cycle more and access these green spaces. And It's well shown internationally and nationally that increasing the investment in good networks of cycling infrastructure leads to increases in the volumes of people cycling. The image there is from Walthamstow in London, and they would have availed of Mini Holland investment and funding for their neighbourhood and in Waltham Forest and other boroughs. And from what I can see, there have been significant improvements and benefits to the local community with this. Not only is it reducing air pollution, congestion and it's taking inspiration from, for example, the Netherlands with this, it is increasing the amount of people who are getting outside and cycling. Early research showed that, for example, in those high dose areas of Mini Holland redesign, that people were 24% more likely to have cycled in the previous week compared to those areas which didn't have the redesign as of yet. And it's really important to highlight with this that improvements in safety come from providing the good, proper infrastructure and the protected cycleways, and that increases the amount of people cycling and getting outside. Increasing human connection is about social connectedness. Social isolation, loneliness, and living alone are all significant risk factors for premature mortality. Cycling is a physical and social activity which opens up the possibility of connecting with one another. Cycling, in comparison to driving a car, results in more spontaneous interactions, it results in more friendly interactions. The very nature of being on a bicycle and being out in the open, it lends itself to more easily to engaging with other people. It's easier to get on and off a bicycle than it is to get in and out of a car. The speed at which you go at when you're cycling, it gives you a greater awareness of your surroundings. Cycling, I feel, can help bridge the disconnection between individuals, and it lends itself to the idea of open communities, vibrant communities, open cities. The image is from Cycling Without Age in Sheffield, and Cycling Without Age is an initiative which started in 2012 in Copenhagen to bring people out on bike rides, to enable people to get outside. It might be supporting people who, there may be a pattern where they spend a lot of time or living in settings where there's a lot of time spent indoors and sitting down, but there's a volunteer who brings somebody out for a bike ride, and it's a social interaction for both people. It benefits both people, and many people may have previously cycled, but they may be unable to do that independently now. They may be more frail, but they still get to experience that rush and that feeling and that joy of cycling again and feeling that wind in their hair. And this example and cycling as a whole can be a way of challenging the high levels of social isolation, loneliness, and exclusion being experienced in society. Challenging cultural norms. So, patriarchal attitudes impact on physical activity levels. The WHO states that gender inequalities are pervasive in all societies. And in the UK, health inequalities relating to both gender and ethnicity are evident. If you look at cycling, there is inequity in cycling. In London, for example, only around 1 in 3 people cycling are women, and less than a quarter are people from minority ethnic backgrounds, even though they represent well over a third of the population in London. And there's a multitude of factors for that. And I touch on a couple of things that support to make cycling more inclusive and challenge these patterns. The WHO state that social marketing campaigns and community-based interventions are core recommendations of enabling physical activity for everyone. And for example, social marketing campaigns, the stories that we tell and the images that we put out are so important. They need to be inclusive and reflect the diversity of the population, because, for example, evidence suggests that the lack of a relatable portrayal of women can inhibit mass participation in physical activity. Community-based interventions enable people locally, for example, from groups that may be traditionally underrepresented, to start cycling and take up cycling. And this may be through grants in London to local organisations and community initiatives that are provided, and here in Glasgow, where I am, there's a fantastic local charity, Bike for Good, and they support people through providing free confidence building sessions, providing buddies so that other people can cycle, so people can cycle together. They even provide free bike loans on a monthly basis for people who want to start cycling. So these are the things that are giving a helping hand to people to take up the bicycle, and this targeted investment is needed and thankfully is happening, to couple with the wider investment that needs to happen with the physical infrastructure on our roads. Essentially, with this chapter, what I sought to express is that cycling is a microcosm of the macro of our wider society, and by challenging the inequity in cycling, we're also challenging the inequity in wider society. And cycling can be a reflection of social norms and cultural norms, but it can also challenge them. It pays to cycle. Good work is an important productive factor. Good work means having a safe and secure job, with good working hours and conditions, supportive management, and opportunities for training and development. The benefits of cycling and cycling to work are astounding. People feel happier, people are more productive, and for example, regular cycle commuting was associated with a 45% lower risk of developing cancer, a 46% lower risk of developing heart disease. This is in comparison to a non-active commute, which is probably doesn't get the attention that it should. In addition to that, I was surprised to find this statistic, that transport is, or was, in recent years, the category of highest average weekly spend by UK households. So people can save money by, taking up cycling as opposed to driving a car, if possible. Cycling, the running of a bike, generally costs little to nothing. And in addition to saving money, you can also earn money from cycling. And I don't really explore examples from the gig economy in this chapter, because the gig economy is not synonymous with good working conditions, but there is that potential out there as well, and we see it in our towns and cities, for example, with people delivering food, and they're doing that via bike. Also, the cycling economy and the bicycle, there's a momentum to it, and it is growing. And the image there is of the courier company Pedal Me and their bicycles, and they are challenging the status quo in London with what is traditionally required to deliver heavy weights, and instead of a van or a motor vehicle. And this image is from April 2020, when they partnered with the local council to deliver food parcels to local residents who are shielding. And I've seen images online of just what they're delivering, and it's incredible what they are able to move. And they are a reflection of the growing cycling economy. And as we shift to a greener economy, cycling is going to play a bigger role in this. Whether implied or self-implied, cycling enables you to save money, earn money, and feel better while doing it. The last chapter on a determinant of health is saving the NHS. We've probably all seen headlines like this: NHS staff quitting due to burnout and bullying, and it's a reflection of the system being stretched and the people at the heart of it being stressed. What I'm arguing throughout the book is that there needs to be an increasing focus on prevention from government and also within our healthcare system. Cycling and improving health and quality of life can significantly decrease the demands being placed on hospitals and GPs. The benefits over time of physical activity are vast, and I mentioned earlier about the 2018 scientific report in the US for their physical activity guidelines, and this is where all these benefits are taken from, showing the benefits from children to adults to older adults. I like this quote from Michael Marmot: "What good does it do to treat people and send them back to the conditions that make them sick?" Of course, we need to treat people reactively, but we need to address proactively the conditions that make people sick. And NHS organisations, as anchor institutions, have a responsibility to enable cycling for their employees, for people who interact with their service, and across their communities. In the final chapter, I sum up, cycling is not a panacea, but for me, cycling lends itself to our aspirations of a fairer society, and cycling makes people healthier. Investing in cycling creates healthier environments, which helps to normalize cycling for everyday movement. Cycling connects people, cycling helps school children, and cycling can help our health service become more efficient, increasing access, and depending on the time frame, saving millions or billions of pounds. I included this graph in the final chapter to illustrate the low base internationally where the UK has been in terms of cycling. This is from 2013, from a survey of over 27,000 participants in the then 28 EU member states. And the UK, in response to cycling more than once a week, came 25th out of 28 participants. Here you can see on the left you have Netherlands, Denmark, Finland. On the right at 9% you have the UK, and this was based on urban settings. So even though in the last year and a half there has been an uptake in people getting out on the bike and positive things are happening, much more long-term investment is needed and much more can be tapped into in terms of the popularity of the bicycle as a mode of transport. I like this quote from Jan Gehl. It's not included in the book, but first we shape the cities, then the cities shape us. First we shape our built environments, and then they can impact significantly on our health and our quality of life. This also isn't included in the book, but I really like it because cycling and investment in cycling, the redesign of our built environment, is about enabling everybody to move that a little bit more and making cycling and movement the easy choice. And this illustrates that the biggest benefits occur in people, for example, who are moving the least to just move a little bit more. And that's what redesign of our environments and investing in the physical infrastructure is doing. It's allowing people, everyone, to move that little bit more. I hope you enjoyed the presentation. This was just a quick run through. I'm on Twitter, that is my handle, and if anybody wants to get in touch, you can do it there. I also have my website, which this year I have shared a few posts. Please feel free to get in touch. The book is this. It's a very little one. It's available on the website. Please feel free to give me feedback and share online if you like it. Thank you.